I'm the director of the State of Maine Center for Disease Control and Prevention. I'm delighted to be here with everyone today to provide an update on the COVID-19 situation across the state of Maine for today, Thursday, July 23rd, 2020. We're joined today by Ms. Maura Nolan, who's our interpreter. Just so everyone's aware, Dr. Thibodeau and Josh are doing just fine. They're working on other assignments elsewhere today. Overall, in the state of Maine, there are a total of 3,737 cases of COVID-19 statewide. Of those cases, 3,334 are confirmed and 403 are probable. Overall, across the state, there have been 118 deaths and 378 individuals who have been hospitalized at some point during their bout with COVID-19. Right now in Maine, 12 individuals are hospitalized. 8 of them are in the ICU and 3 on ventilators. And in total, statewide, 3,239 individuals have recovered. Among our cases are 861 healthcare workers as well. And since beginning our activation, Maine CDC epidemiologists have fielded now 10,800 requests for consultation from healthcare providers across the state. I'd like to provide an update next on some of the outbreaks that Maine CDC has been most active in. Let's start with a few notable outbreaks that we've just recently closed. One was at Bath Iron Works, where there had been a total of 3 cases. The second is at Cape Seafood, where in Saco there had been 10 cases associated with that facility. And finally, at Falmouth by the Sea, a longstanding outbreak, Maine CDC recently declared that outbreak to be closed after a total of 75 cases. I'd like next to talk about a new outbreak investigation that we've just opened in the past hour or two. And that is at the Marshwood Center in Lewiston, where there are a total of 11 cases, 8 among residents of that facility and 3 among staff. One note, the numbers that I've just mentioned, those 11 cases, are not included in today's case numbers. They will, however, be included in tomorrow's numbers. But given that we've just opened the outbreak investigation before 2:30 p.m. today, I wanted to report on it for everybody. There are also 2 outbreaks that Maine CDC continues to be quite heavily involved in. One is at the American Roots manufacturing facility. As many of you may recall, that facility just finished its second round of universal testing among all staff and employees. And the test results are almost all in. Thus far, we've gotten back 90 of the 94 tests that were taken. And of those 90 test results that have come back in, each and every one of them was negative. I'd also like to provide an update on the Walmart outbreak up in Aroostook County. Maine CDC epidemiologists have had a number of calls with Walmart, and thus far they have not detected any new or further cases. We've also looked at reports that the outbreak may be associated with construction that was going on at the store facility. We've reached out to the contractors and the subcontractors who were working on the scene to see if there were any reports of illness or symptoms. Thus far, we have not learned of any. But again, our investigation into both of these outbreaks continues. I'd like to thank the management of both American Roots as well as that at Walmart for their close cooperation as we investigate both of these workplace outbreaks. I'd like to next provide an update on some of the epidemiological metrics that Maine CDC tracks to help us get a sense of where we are in the outbreak right now. Let's start with the positivity rate. Based on 2,653 PCR tests reported to Maine CDC yesterday, the one-day point positivity rate, just for yesterday's test reported, was 0.98%. That takes our 7-day PCR weighted average to 1%. For reference for everyone, our goal is to keep that number as far below 2% as possible. 30 days ago, that number was 1.76%. So progress has been made. And for reference, right now, today, the national rate of positivity stands at 9%. I'd also like to provide an update on the testing volume. We measure testing volume by the number of PCR tests conducted per 100,000 individuals. Maine's number has continued to trend upward. Today, it stands at 182.5 tests for every 100,000 individuals in Maine. That represents 76% growth over the past 30 days. And finally, the other metric that we track is the hospitalization rate. Right now, the hospitalization rate in Maine is 1 per every 100,000 people. For reference, again, the national rate across the country right now is 17 per every 100,000 individuals. Now, as I've talked about in the past, although these figures are encouraging, they are not an occasion for a victory lap. The situation that continues to unfold across the western and southern states could still take hold in Maine. And for that reason, I continue to ask and urge everyone to keep both feet firmly on the gas. And finally, before I turn things over to our colleagues in the media, I wanted to take a moment to reflect on the fact that, as many of you may be aware, today was the second annual Opioid Summit convened by Governor Mills. It actually just concluded, which is why today's briefing was moved a half hour. I wanted to take the occasion of today's summit to recall that even though we are in the midst of one epidemic, COVID-19, there is another parallel epidemic that has not abated, that involving drug overdoses. Preliminary estimates project a total of 259 overdose deaths for the first half of this year alone. That's a staggering figure. That's 259 families who are grieving. That's up to 259 daughters or sons who went gently into that good night, and potentially leaving behind 259 mothers and fathers who lost a child. That's 259 spouses who may now be sleeping alone. 259 places at the dinner table that are now empty. And perhaps most wrenching of all, perhaps up to 259 children for whom their parent will only be known through a picture or a video. As with COVID, we sometimes, myself included, have a tendency to talk about numbers as abstract data points. But we must not do that. Not with COVID and not with substance abuse. Every single one of these numbers has a name. And every name was a daughter, a son, a spouse, a coworker, a community member, and a friend. The opioid-associated effects of the pandemic have not been fully assessed, but we know thus far that the experience of COVID-19 has been a definite stressor, particularly for individuals grappling with substance use. We talk about things like isolation in the context of COVID-19 without realizing that for individuals with substance use concerns, isolation means something far more frightening. And at a time when folks who are struggling may need a shoulder to cry on or a hand to hold, the strictures of COVID-19 may mean that neither is there for them. What COVID-19 has shown us is that we need to find new ways to help. and we have done so in Maine. If there's one thing that I've learned from my first 13 months in Maine, it is that Maine people can do big things. Maine people can rise to the challenge when the call of the community demands it. When there is a big job to do, people in Maine can get it done. We've done so with COVID-19, and we'll have to continue to do so with substance use. But I say this because it's all too common to hear that nothing ever changes, that big things can't be done. I'm here today to tell you not to let anyone ever tell you that nothing ever changes, that hard problems cannot be solved, that progress is out of reach. Maine people can do hard things. How do I know that? Because we have already done them with respect to the way that we have confronted COVID-19 head on. We now have an opportunity, a continuing opportunity, one that was always there, to flatten another curve. That curve involves the continuing challenge of substance use overdoses. And as with COVID, we can do the same thing with substance abuse if we keep 4 guiding principles in mind: science, compassion, commitment, and community. Many of you watching right now may yourselves be struggling or know someone close to you who is, perhaps with substance use, perhaps with other challenges. Please know that none of us is alone and none of us is an island. Help is available. One place to start is by calling the Maine Crisis Hotline. The number for that is 888-568-1112. That number again is 888-568-1112. Help is available. There is a hand to hold and a shoulder to cry on. All you have to do is start making that call. So with that, I'd like to turn to our colleagues in the media. And today's first question goes to Steve Missler from Maine Public. Welcome back, Steve.
Thanks. Can you hear me okay?
Yep, go ahead.
Oh, great. I'd like to ask you about the Maine Office of Tourism, which is apparently spending $2 million encouraging people to rediscover Maine. I think that's the name of the campaign. Now, my understanding is that the campaign supposedly targets the people in 5 states that don't require, or we don't require visitors to quarantine or show evidence of a negative tests. But are you at all worried that moving from a permissive message to visitors from those states to one that actually asks them to come here risks undoing any of the work you and the administration have done so far? And I do have a second question.
Sure, Steve. I'll take that one first. It's a concern. It's anytime we introduce movement of any individuals within the state or from other states, there's the risk that they may carry COVID-19. But the way in which we've approached from an epidemiological perspective, the states that need not have individuals bring a negative test result or stay the 14-day quarantine is we've looked at epidemiological parameters that try to point toward one central question, which is what is the prevalence of disease in those areas? The theory is that if the prevalence of COVID-19 in any of those states is as low or lower than that of what it is in Maine, an individual coming from those states does not add to the risk faced by Maine people. That's the standard by which we've approached that determination. And so in epidemiological terms, although there are no guarantees, the data suggests that the individuals from those states can come to Maine for short periods of time, like vacation, and not bring an added risk with them. So that's the theory behind it. We're continuing to monitor the data, though. It's not a one-way ratchet. We continue to monitor the data in the states, those 5 states where that exemption has been granted, to see if the situation becomes such that they may be less safe than Maine. And if so, then changes may be made.
Yeah, great. So the second question, sorry, had some trouble with the mute button. And I don't think you mentioned it today, but how many cases from out-of-state visitors do we have? I think the last you mentioned it was 120.
Mm-hmm.
I don't know that you mentioned it today, and if I missed it, I apologize. But if there's an update there, that'd be good to know. And I guess related to that is, how come that information isn't being published on the CDC website? I know you're providing it when asked, but I'm just wondering why it's not there.
Yeah, we could certainly look into publishing it, Steve. It's something that I provide at least every week. And there's a lot of data points that are out there that we tabulate, but that we don't necessarily always put on the website because I speak to them at the press conferences. And so we could certainly look into that. As you noted, on Tuesday, I reported the latest figures, and those haven't changed. There's still 120 cases representing 133 positive tests.
Okay, thank you so much.
Yep, you bet. I'm going to turn next to Caitlin Andrews.
Good afternoon, Dr. Shah. I was taking a look at the most recent zip code data, and it seems like the highest per capita cases in the state have really more focused on the Portland area towns and Lewiston, York County. Specifically, the town of Falmouth now has the highest per capita cumulatively, where a month ago it used to be the tiny town of Medway in Penobscot, which hasn't seen any new cases in quite some time. What does that kind of say to you about how the virus is still spreading in the state?
Well, it says two things. One thing, Caitlin, is as we've talked about before at these meetings, those data are a snapshot of a train that continues to move very quickly. And as it moves across the state, those figures will change. Areas that were previously higher areas of concentration of cases, as those cases are resolved and individuals recover, that may shift to elsewhere. That's to be expected in any outbreak situation. But it also suggests that areas of higher density see more cases, even on a per capita basis. This should not surprise us. That really one of the strongest predictors of whether there will be a significant number of cases in an area is the density, the population density in that area. When you combine population density with things like residential facilities, nursing facilities, you not only have the possibility of a number of cases in the population, but you have the simultaneous possibility that those individuals could introduce those cases into vulnerable areas like nursing facilities. The outbreak that we just concluded at Falmouth by the Sea is perhaps exhibit A in that regard. The third thing it tells us, though, is that these data can change very quickly. On a week-to-week basis, the complexion of the outbreak in Maine can change very, very rapidly. And especially with something like zip code, I urge caution in reading too much into it as individuals are gauging their own risk. The data are interesting, but I recommend that you not use just zip code data as you're thinking about your own family's risk. As I've mentioned before, in Maine, it's entirely plausible for one single person to traverse through 4 or 5 counties in a matter of a day, just as part of their normal lives, which could comprise 10 or 20 zip codes. And if that individual happens to be COVID positive, they could introduce and spread the virus in all of those areas. So the zip code data are there, they are part of the equation, but that should not be the only thing that someone looks to as they're gauging their own risk.
Thank you.
You bet. I'm going to turn to Bob Evans at News Center next. Hey, Bob.
Thank you, Dr. Shah. President Trump this week seemed to give mask wearing his strongest endorsement yet. Do you think that may help with people who are still on the fence or may still be skeptical about wearing masks?
I certainly hope that it does. It's what I think is important is not just the message, but the consistency of the message. And in that respect, I hope that the president continues to endorse the use of masks. What we know about face coverings or face masks, face coverings is usually the term that I go to, is that the science tells us they are really effective at minimum at preventing you from spreading COVID-19 to others. That's one of the most important things. But there's emerging data. And again, I've mentioned this previously, but I want to underscore it again. These are just preliminary data. But the preliminary data do suggest that the face covering not only prevents or reduces your likelihood of spreading COVID-19, but it may simultaneously reduce your likelihood of inhaling the virus that causes it. So face coverings may serve two benefits. They may not only help reduce your chance of spreading it, but they may also reduce your chance of getting it. Given where we are in the crisis right now with COVID-19, wearing face coverings, as President Trump recently suggested and tweeted a picture of himself doing, if everyone were to do that, our collective risk of COVID-19, according to some models, would drop significantly. Now is a perfect time as more folks are going outside, enjoying the weather, reconnecting with social and work-related activities. Now is a great time to wear those face coverings.
I have one more question, if I may.
Please go ahead.
With summer camps in full swing in Maine, do camps have to follow the same 50-person gathering limit? And if they are accepting campers from out of state, what COVID testing process needs to take place for them and how often?
Sure. So we approach camps the way that we would any other situation, which is to say, if those individual counselors, staff, and campers are coming from other than one of the 5 states where testing or quarantine is not required, negative test is required. Now, with respect to the 50-person gathering limit, that really does depend on the nature of the camp. Some camps have cohorted children into campers into smaller groups. Others have made sure that all the children or the campers were all negative, and so they can kind of be approached as a bubble. So it really does vary based on the setup and the physical arrangement of the camp. But the baseline idea is similar to what we would say for any group, which is to say, smaller the better. The 50-person gathering rule applies based on the physical layout. And if individuals are coming in from states where they are not on that list of 5 that are epidemiologically similar to Maine, a negative test or a 14-day quarantine is the best way to keep everyone safe.
Thank you.
I'm going to turn to Joe from ABC7 next.
Dr. Shah, thank you for taking the question. I know you're a numbers guy, and I like looking at your graph that you guys have on the CDC website. So you can stop me if I'm wrong, but if you were to look at the recovery cases and subtract them from the total amount of cases, you basically get an active amount of number of cases we have in the state, correct? That we know of.
True, yes.
So my question is that since June, we've kind of fluctuated between 300 and 400 in over 2 months. And throughout the course since April, we've never really gone above 600. And just the explanation I was looking for is, does this data provide any sort of conclusion or explanation about what we've been doing to help slow down the virus or keep it away from certain sample sizes, or is the sample size just too small?
Well, Joe, it's a little bit of everything here. It's a good question. It's one that we've talked about internally here at Maine CDC. So the designation that you use at active cases, it's predicated on a few things. One is the math that you mentioned. It's effectively the number of individuals who have not yet been deemed to be recovered. You'll note on our website, we don't characterize them as active cases. What it really is individuals who have not yet been classified as recovered by a Maine CDC epidemiologist. I know that in common parlance, it's thought of as an active case, but an active case conjures up visions of an individual who's coughing and extremely ill, as if it were active tuberculosis, for example. In this situation, an active case, as you use the term, really is someone who just hasn't yet met the criteria that the US CDC has set forth for being deemed to be moved into the recovered bucket. What we can tell about those cases, that category of other, as we label them, is, as you note, Joe, they have gone down a bit, although there has been a fair amount of stasis recently. That is rather consistent with what we've seen based on the number of daily new cases, which for the past few weeks has hovered in a pretty tight band of anywhere from 15 to 30 cases or so. And when you've got largely the same number of new confirmed cases coming in every day, it stands to reason that that number of other cases, just by the arithmetic, doesn't usually change too much. But I just wanted to underscore that the active designation that folks talk about should not be read to imply that these are individuals who are extremely ill, who are necessarily hospitalized. Some of them are, make no mistake, but others may have different variations or milder forms of illness. I'm going to turn to Ashley Blackford at WAGN.
Hi, Dr. Shah. I have two questions for you. The first one, if there are positive tests from contractors and subcontractors, say at Walmart, and they're from other states, will those numbers initially show up in Aroostook County and then be transferred?
So the way that we handle outbreak situations, Ashley, and a good analogy or a good case study in this is how we approach the outbreak at the Chimbro construction site, which, as many of you will recall, involved a high number of individuals from different states, from Wisconsin to North Carolina. In an outbreak situation, given the importance of that outbreak, we report all of those cases. We want to make sure that in an outbreak situation, everyone is aware of what's going on, irrespective of the state of residence of where someone is.
Okay. And now we have received a few calls from people who have been at Walmart over the past couple of weeks who are concerned. Do you recommend people get tested, or what should people do if they are concerned?
If folks are concerned, the question is whether they've been exposed to somebody who is known to have COVID-19. What we've learned from Walmart, we're still learning from Walmart about the nature of the interactions that the three individuals who tested positive may have had. But the other thing to keep in mind is that the exposure that's required to transmit COVID-19 is more than just a casual or fleeting exposure with somebody that you may have walked by in an aisle of a store, for example. It really does require more sustained exposure, 15 minutes typically. If individuals were wearing face coverings, both the employee as well as the shopper, then the likelihood of transmission because of a casual interaction, a couple of minutes, even 30 seconds, asking somebody where an item might be, the risk of transmission is low. It is not zero, however. And so if individuals are concerned, the best thing to do is to check in with their physician, chat with their physician. Their physician will have a better sense to know if they have medical vulnerabilities that may make them better candidates, more likely to need to be tested, for example. So it's a highly particularized, individualized decision that depends not just on the length of time they were in the store, but also other medical conditions they may have that may point the direction toward getting tested. I am going to turn to Kevin Miller at the Press Herald next.
Great, thank you. So kind of following up on Steve Missler's question from earlier, I appreciate the updates on the out-of-state testing or folks who tested positive. Can you provide an update on how many tests have been run for out-of-state residents? And I know that you've talked in the past that a lot of these folks are New Hampshire residents who get their health care from Maine, in Maine. But are you seeing that change as we see more out-of-state people come up here and vacation?
Yep. Kevin, we'll get that number for you. I'm just checking my notes to see if I've got it. I don't believe we do have that number. We'll get that for you ASAP. We've also taken a look at the trend line. And of course, Kevin, the question there is whether the change in testing rates from out-of-staters has changed relative to the, say, 70%, 76% increase in testing for all Maine people. And so we've taken a look at that. It hasn't really changed dramatically. It's largely been consistent in the same way that testing overall has changed. And so we haven't noticed any radical differences between that testing rate line and the overall testing rate line. And then as you as you did note, Kevin, it continues to be the case that many of the individuals who list their primary residence as being in another state who have tested positive in Maine, many of them continue to be from New Hampshire. So those are folks that live right across the border that get their health care in Maine, or in some cases, they visit a New Hampshire affiliate of a Maine-based healthcare provider, and those laboratory tests just get sent to Maine because of that corporate affiliation. And that continues to be a large part of the out-of-state testing that we see. And again, we'll get you that total number, Kevin.
Okay, great. And then just a quick question on the Walmart case. Have you say you've been talking with the corporate executives or folks from Walmart and talking to them? So it doesn't sound like you've at a point where you know where those workers were working, in what department, and do you know can you tell us whether the company has taken any steps to either sanitize areas or close areas or any other steps that you're aware of?
So we've talked to them. One of the things about the workplace situations is that there's a high number of individuals who come in and out. So one of the requests that we've made of Walmart is to try to get a better sense of where these individuals, where exactly they may have interacted. And in terms of sanitation requirements and such things, we're in the process of discussing with them what the best approach is. We understand that Walmart has already undertaken many of those measures on their own. And so given the time that may have elapsed between when these individuals were infectious and when they were out of work, it's not clear that the sanitation piece would probably add much, but we understand that Walmart has undertaken much of that already.
Okay, great. Thank you.
You bet. I'm going to turn to Megan from WMTW next.
Thank you, Dr. Shah. My question is something about the Department of Education's updated framework for returning to classroom instruction. In it allowed for students to be 3 feet apart if they're wearing masks. So my question really is, what is the reasoning behind allowing 3 feet of spacing? Because we've kind of been talking about since the beginning, 6 feet apart. So if kids are 6 feet apart, is it okay to go without a mask? Is the difference the mask there?
Yes. So Megan, you put your finger right on it. The difference there is the mask, but that's in concert with other safety measures that are also being recommended. Desks facing in the same direction, things of that nature. So this is based partly on an analysis that some other countries have done, as well as the American Academy of Pediatrics. And the American Academy of Pediatrics took a hard look at the data. And what they found was that when this constellation of measures were undertaken, face coverings coupled with all of the other things that we've talked about, the added benefit of being 6 feet away on top of 3 feet away was not that significantly greater. That applies to A, making sure that all of those other safety measures are in place, and B, it really is a recommendation that thus far, according to the American Academy of Pediatricians, should be construed only as to children. Whether this would apply for adults, which as many of you have seen, adults seem to get COVID-19 and transmit COVID-19 at higher rates than children. So this 3 feet recommendation should not be taken for adults. It really is something that is unique to children and unique to the classroom setting. In the classroom setting, there's not usually a lot of interaction insofar as children running around, singing, vocalizing, yelling, things of that nature. When coupled with face coverings and some of the other protective measures, the AAP, the American Academy of Pediatricians, felt that 3 feet was acceptable. I'm going to turn to Patrick Whittle from the Associated Press.
Thank you very much, Dr. Shah. Two things. I'm wondering if there are any more details available about the outbreak at Marshwood Center, such as when the state became aware of it, and just if there's anything that can be said about the nature of the outbreak. And also, I'm curious if the state might be getting closer to loosening travel restrictions on states beyond the ones we've already seen.
Okay. So Patrick asked to Marshwood. I think we became aware of it just in the last few hours. I became aware of it in the last hour and a half, if that. And I think our team probably just in the past few hours. And so that's, again, why the numbers from the outbreak are not even contained in today's case count, but rather will be on tomorrow's case count. So this is, in that sense, Patrick, we are at the earliest of the earliest stages of our investigation. We'll have a lot more understanding of what the layout of the facility is, what the work schedules of employees are, what the vulnerabilities of the residents are as our outbreak investigation continues. We do understand that this is a facility that has already been taking part in our program or to assist with universal testing of staff. And so one of the things that we're looking for is how this outbreak was detected. Was it detected as a result of that universal testing protocol, or were there individuals who were symptomatic and thus that how it was detected? That's one of the key questions we've got right now. But at least as to my team's understanding of it, we're just in the initial hours, and so more to come on that. With respect to the travel restrictions, we continue to take a look at the data from other states outside of the 5 where the exemptions have already been granted. No final or no new determinations have been made, but we are continuing to look at the data. As I mentioned with Steve, our principle is to look at states to see when they have achieved the threshold that marks them to be at least as safe, if not safer than Maine from a COVID-19 prevalence perspective. Once they get to that point, the arrival of individual tourists from that state does not really bring any additional risk. So that's the metric, or that's the mode of analysis that we undertake as we're making those determinations. And as of right now, no new determinations have been made. I'm going to turn next to Amy Brown at WERU.
Thank you, Dr. Shah. I have a couple of questions from a listener regarding some things that they heard Dr. Birx say in an interview yesterday from the White House coronavirus response team. She said that kids with pre-existing conditions should not go back to in-person schooling. And the listener is wondering, do you agree with that? And also, what conditions should parents be concerned about? And I have a follow-up on that as well.
Sure. I didn't get to hear Dr. Birx's comments. I think the ultimate decision of whether a particular child should go back to school is really one that ultimately, if a child has pre-existing medical conditions, should be one that's made jointly by the child's parents working with their pediatrician. There is no single set of medical conditions that allows a child to be okay going back to school, or by converse, should necessarily exclude them. All medical conditions exist on a spectrum. Some can be well controlled, some may not be. And so that question is really not one that can be, and frankly, nor should it be answered with a bright line, one size fits all rule. There could be certain medical conditions where, in the opinion of the child's pediatrician, going back to in-person education may not be safe at this time. Others with good management and good oversight could be. There's not a one size fits all approach. That's why right now is an important time for every single parent to be checking in with their pediatrician, not just for questions like these, but also for that other critical thing for back to school, which is making sure every child is caught up and up to date on their vaccinations. Now is the time to make those appointments and get your kids ready to go back to school and have that frank conversation with your pediatrician.
Thank you. And her other question about Dr. Birx's interview yesterday was that Dr. Birx apparently talked about states in the Northeast possibly transferring tests to the southern states where they're having a surge right now. Is that anything that Maine has been asked to do? And if not, would we if asked?
I have not received any request of that nature. So I'd really have to take a look at what the nature of the request was and where or how we would go about doing that. Transferring a test is not it's not something that you can just toss into a FedEx box and send over. It involves highly scientific, delicate equipment, chemicals that are very proprietary to the type of test that we use here, a test from IDEX, as folks are aware. And if another state uses a test made by a different company, our chemicals would not work on those. So it is a very particularized question. We, of course, would always help any other state in need. That's what we do. But it's not so simple as saying, sure, we'll help, because, of course, the devil is in the details here. Sort of as with your other question, it's not a one-size-fits-all thing. We want to help, but we also have to make sure that the help that we may provide actually solves a question. If we throw a bunch of chemicals in a box and send them to another state and they can't use those because they use a different machine, we haven't helped anybody at all.
Thank you.
And today's final question today goes to Brian Sullivan.
Thank you, Dr. Shah. I guess I was wondering how familiar you are with the Bangor School Department, and they had laid out an initial framework for their going back to school plan. Can you just tell us at all if your familiarity with it and your thoughts on what they had laid out? They also said they anticipate being classified as a green county in Penobscot County. Just if you had any comments on that and how many counties you think might be classified as green when we do get that announcement next week.
Sure. So, Brian, as you noted, we're looking at all those data right now and preparing that. I can't speculate as to what they might look like at the time that we do the final runs and polls of all the data. We're gonna make sure we meet our deadline and put those data up. But until then, I can't really speculate about what they may or may not say as to a particular county. As to the Bangor School District's plan, really, I think DOE, the Department of Education, will have been in much closer contact with the school district there to review any specifics around their plan. Every school district is thinking about this issue in a much different way. Although there are some core similarities, face coverings, hand washing, things of that nature, the idea is to allow for local control with respect to the way in which these public health best practices are implemented at the city school district level. There are going to be different ideas, and we're standing by to work with school districts on the public health implementation of those ideas. We're in a situation really that I can't think of in recent or modern history that school officials have ever had to face. And so we call upon them for their creativity. We in turn will help them from a scientific perspective to make sure that what they are thinking about doing accords with the best practices that we are keeping on top of, that the US CDC has endorsed. So before we wrap up today, I just wanted again to recall and remind everyone that these are very, very difficult times. The COVID-19 pandemic is still very much with us. And the virus, even though we may be done with it, the virus itself is nowhere near being done with us. And everyone is grappling with COVID-19 in different ways. For individuals who are struggling with substance use disorder and other behavioral health concerns, the strictures that have been introduced by COVID-19 are perhaps more pressing and more hard-hitting than perhaps for anyone else across the state. I'd again like to just remind everybody that many of you watching right now yourselves may be struggling. You may know somebody in your family or in your community who is struggling. Please remember that none of us is alone. None of us can face the tremendous weight of COVID-19 coupled with behavioral health challenges all on our own. None of us is an island. Help is available. There are individuals right now who are standing by to speak with you and to help you if help is what you need. Please call the Maine Crisis Hotline at 888-568-1112. If there is help that you need, there are folks who are standing by to offer it. So thank you all for taking some time out of your afternoon to join us today. I hope everyone has a great day. As always, please be kind, take care of one another. We'll talk again next week.